Hi, today I want to talk to you about what's called adverse neural tension, which is just basically when nerve tissue has adverse stress on it, and it can create symptoms such as numbness, tingling, or anything, or even pain. Anything that seems like radicular symptoms or disc symptoms radiating down the extremities, or even something like a thoracic outlet syndrome or nerve compression syndrome, etc. So anyway, adverse neural tension is just basically a situation that's not clear cut in every case. So what happens is that when a patient has had a lot of tests, a lot of workup and diagnostics, and there's still no conclusive idea of what's going on with the patient, but yet they have these neural symptoms, let's say, that don't seem to be going away, or they kind of change with different positions. That's adverse neural tension, okay? So it could be very frustrating, very aggravating, very debilitating, depending on how you approach it. Now, what I noticed is a lot of therapists, as well as trainers that work with clients that have these symptoms, unintentionally tend to flare this up in their patients or clients. So I'll just share with you a patient I treated recently, who presented with, for over a year, right upper extremity symptoms, numbness and tingling, pain, etc., where she's been to every doctor, every specialist, who none of them had an answer for her, and basically they even checked her for some hereditary or some genetic disorder, which was crazy. And what I found in her was basically all her symptoms were caused by adverse neural tension, but not so much where they were presenting in her upper right quarter, upper arm, what basically from an instability in her pelvis and her lower quarter, her lower body, where her pelvis had a tendency, in general, had a tendency to be rotated forward more, creating more turning on of her spinal erectors, so to speak, and her lumbar erectors were extending rather than her using her hip extensors. Okay, so in a nutshell, that locked up her whole lower body. She had bilateral knee issues, she had surgery, knee pains, tears, she has chronic low back and neck pain, and interestingly enough, she's in her 30s, but before the age of 10, she had multiple fractures throughout her body. She's been in multiple injuries and accidents. So you could just imagine, to her neuromusculoskeletal system, to her nervous system in general, how much instability had to cope with over the years, or compensate with. So her pelvic instability was creating increased neural tension, where all the load would go up to her upper quarter, up to her shoulder girdle complex, to her neck, her head, and being a right-handed dominant, that's where all her symptoms were. So it wasn't until we were able to calm down all that nerve tension in her pelvis and lower back, and then teach her how to use her hip extensors, her upper hamstrings, her gluteals, her lower abdominals, teach her about her use her diaphragm more effectively with her deeper abdominal wall to reset her rib cage, to help reset her pelvis, let's say, put her in a better position. Her right upper quarter symptoms, neural tension symptoms, started to improve. So basically, when you have adverse neural tension signs or symptoms, don't mess with them. Don't keep poking around the area where the symptoms are, because you're going to flare them up. And nerve tissue is very unforgiving, where it's easily irritated and the symptoms last longer before it starts to calm down. So the key is to really find where the most tension is and unload it. And then once you unload it, your game's not over there just yet. After you unload it, you have to support it. Support whatever was being compensated for with increased tension in the first place. So example with my patient, her hip extensors were not working whatsoever. So her lower back muscles, all the spinal erectors, were compensating to create some crude sense of stability in her pelvis. So once we unloaded that tension there, by calming those muscles down and helping her, teaching her to actively, as well as passively, reposition to unload her pelvis to a more posteriorly centrated position, let's say. We started to retrain her upper hamstrings and her gluteals to stabilize the pelvis. And that takes some time because you're overriding a whole lifetime's worth of motor programming, but you're giving back to something that you released or something that you unloaded. And she's doing very well. So anyway, that's just what I had on my mind today, and I just wanted to share that with you. And until the next time, have a great day.